Hi, my name is Dr. Andrew Lipton.
And I'm Ashley Rhoads, nurse practitioner.
We're here at Narberth Family Medicine today, and we'd like to talk to you about stem cell therapy, something that we've been offering here for the last couple of years and have been gaining lots of interest online, on social media, and I want to answer some questions you may have about it. The first thing is what is a stem cell?
So a stem cell is basically an immature cell that is able to differentiate into different cells, so it can go anywhere in the body that needs healing.
Stem cells are the cells in our body that help us heal and repair. If we have an injury to our body, say we scrape our knee, the body, the first thing it does is send some blood cells there called platelets, and the platelets stop the bleeding. And as the platelets heal the bleeding and stop the body from bleeding out, they liberate some chemicals that tell the body, hey, there may be an infection here, and then white blood cells come. And the chemical signals then cause stem cells to come in and repair, and within moments to hours and days, the stem cells heal and repair, and you have new skin there. This happens to every cell in the body, whether it be your stomach cell or heart cells or skin cells, and if we did not have stem cells, we would not heal and repair. So the procedure to basically get stem cells out of your body is relatively easy harvesting procedure. We can get them from a small amount in your blood, a large amount in your fat, and in your bone marrow, and we prefer to get them out of the fat cells because most people have a little bit of extra fat they're willing to give up. The harvesting stem cells is based through a little incision in the belly or just above the buttocks, and we put in a tiny syringe to make it numb, and then we do a lipoaspirate technique, otherwise known as liposuction. Why don't you tell them about what that technique looks like?
So basically, like Dr. Lipton said, we make a small incision, usually in the abdomen, and we infiltrate fluids with some numbing medicine so that it's not painful, and then we go in and we do a liposuction technique to extract the stem cells and the adipose tissue, which is fat tissue, and we have a whole procedure then in the lab that we extract the stem cells from the fat, and then we can inject those stem cells anywhere in the body that the patient would like to promote healing. We can give it IV or into any joint or tissue.
A lot of patients ask, does it hurt to get stem cells? The two main ways that we deliver stem cells are from the bone marrow, and that one hurts a little bit. It's an option. We prefer the adipose, and it's a numbing solution, so people get one tiny stick for the numbing solution like you would at the dentist with Novocaine. And after that, most of the patients undergoing it basically tell us they feel a little tugging and pulling, and the whole procedure maybe takes 10 or 15 minutes. So the procedure generally only takes about 15 minutes, but we allot about a half day, 3 or 4 hours to do the whole thing. Initially, we get you prepped for the procedure, which is basically cleaning off your belly. We make the injection, we remove the fat, and all of that takes 15 to 20 minutes. The longest part of the procedure is then taking the fat and centrifuging it. That means spinning it in a machine to separate the stem cells. Then we wash all the fat out, and we basically centrifuge it down again to get a stem cell isolate that we can then deliver back for treating the body.
And while we're doing this, the patient usually sits comfortably and gets an IV infusion of vitamins and minerals while they're waiting.
A lot of patients ask, well, what's the main way that we use these stem cells? Our most common patients are patients that have degenerative issues or neurodegenerative issues, sometimes cosmetic issues, most typically for cosmetic, face and scalp, for hair regrowth. We've done treatments in, you name the joint, we've treated it. The joint injection takes a few moments to perform, and we can put a small amount of stem cells into multiple joints, or we can deliver it back intravenously to affect the organs, including the heart, the lungs, the liver, and kidney. We've had patients that have seen benefit in their breathing disorders. We've had patients that have seen benefit in their diabetes. We decided to add stem cells because we think it can help so many people. If you start shopping around for stem cells, we're a fraction of the price of most of other orthopedic surgeons and cosmetic surgeons, because we believe that this is a service that helps a lot of people. If this is something that you're really interested in and you think it's right for you, talk to us about it, and we can make payment arrangements.
So there's not much recovery time. You basically have a small incision that we cover with a little bandage, and we have you wear a abdominal binder for 24 hours.
As with any injection of a needle or scalpel, there's always a risk of bruising and bleeding. So the procedure of the adipose removal sometimes has a little black and blue mark. Most people are recovered fully from their bruising or soreness within a day to 3 days. So once we establish the stem cell isolate, depending where we inject it, those stem cells, if we put them into skin, are going to turn into skin. If we put them into muscle, they're going to turn into muscle. So ideally, we inject them directly into the injured area, and the body then takes that stimulus and turns it into the type of cell that you need right there. If we inject it intravenously, the stem cells circulate through the body and basically will go where your body needs them. If you have liver disease or diabetes, then your stem cells, as they're circulating through your blood, are going to go to your liver or to your pancreas. So when we want to focus the stem cells to a specific area, we deliver them directly to that area. If we want to do a systemic treatment, we do it back intravenously, and that would help the brain, that would help all the organs, and we can isolate different parts of the body for different treatments. We treat the lungs with a nebulizer. That's an inhaled solution, like a mist solution, and we put the stem cells in that, and you can breathe it in, and that'll help your nose and throat and sinuses, including your lungs. We can make a stem cell solution with droppers and put it in your eye for people that have dry eyes or glaucoma or any kind of eye issue. We can take a small amount and inject it into your thumb joint if you have osteoarthritis of the thumb, or your knee joint or hip joint, and including areas like the spine, the neck, and back. You name it, we can figure out how to inject it. We cannot put it intraoperatively like a surgeon can. We cannot at this point put it in the spine, but those are potential uses in the future. So what are the contraindications for stem cells? The only one that is specific would probably be cancer. And if we have a known cancer, we don't want to deliver cells to the body that are going to stimulate more cancer growth. And so if that's actively going on, we get people to handle that through their traditional means, and once that's been cleared and it's not an issue anymore, we can still deliver stem cells to joints or to skin or other areas of the body. But depending on the patient's underlying health condition, most everyone can tolerate stem cell therapy. We've had as old as a 92-year-old tolerate the procedure, go home the same day, and we've had people in their 40s and 50s that literally were walking and exercising with their normal routine within the day. Another option that we offer that's not nearly as invasive or expensive is PRP. PRP stands for platelet-rich plasma, which is the plasma of the blood, and platelets are a type of clotting cell, and we take your blood and we spin it in the centrifuge and we separate the serum. The serum is the plasma, and then we take the plasma and we spin that again. The most concentrated form of the plasma has a few stem cells. It may even have 500 or 1,000 stem cells. We take that solution and we can inject it back. It's much more cost effective, and we can do a series of PRP injections every 3 to 6 weeks to stimulate joints or skin or hair growth, and patients have a much more efficient or cost efficient way of delivering a low amount of stem cells. When we deliver stem cells from adipose or bone marrow, we're delivering at a concentration that's 20 to 50 times higher. Literally tens of thousands to 100,000 stem cells are in the isolate. So it's a much stronger solution of stem cells, and it's got a stronger healing potential.
One of the other regenerative therapies that we offer is called Ozone Therapy or Ozone Therapy, which is basically O3 that when we inject into the body, either through a joint injection or through IV, it turns into oxygen in the body and then provides oxygenation to the cells or the tissues or the bloodstream. We use this therapy a lot for injuries. We use it for arthritis, so we can inject it into a knee joint, shoulder joint, wherever you're having pain, we can inject ozone. We also do IV ozone therapy to cleanse the blood, boost the immune system, and kill pathogens. So for chronic infections and viruses, we use ozone IV therapies as well.
Patients ask me, when is ozone indicated as a alternative therapy? And basically ozone, or O3, is a supercharged oxygen or a triatomic oxygen. Oxygen is the number one nutrient in the body. Our body cells start to have injury or pain or dysfunction within 3 or 4 minutes without oxygen. So if you have pain anywhere in the body, it's because you don't have oxygen there. If you hit your thumb with a hammer, it's because you crushed it and that area swells and doesn't get oxygen. It throbs until the blood goes there again. A patient that has heart pain or angina down the left arm is because their heart's not getting enough oxygen. If your joints are feeling creaky and painful, it's because the joint lining's not getting enough oxygen. If you have a Charlie horse in your calf or muscles, because that's not getting enough oxygen. So the idea of oxidative therapy is to deliver the number one nutrient right into the area that's giving you pain. It is a alternative therapy to reduce pain and stimulate your body's healing response.